are 3 psych diagnoses that will probably be on your NCLEX. The first one is going to be anxiety. Anxiety is the feeling of dread, uneasiness, apprehension. Anxiety is on like a spectrum. Mild anxiety is a normal, healthy response. It can help a person focus and problem solve. Not a lot of physical symptoms, but you can see somebody that has mild anxiety, nail biting, sighing, clenching their jaw. Modern anxiety, still you can problem solve, just a little harder to think clearly. The symptoms are a little bit more visible. You're going to have urinary frequency, you're going to have headaches, dry mouth, and insomnia. Severe anxiety is a lot harder because all the attention is inward on trying to relieve that discomfort. Symptoms might be tightening of the chest, shortness of breath, a feeling of doom, digestive issues. This is what happens when it's severe. So panic is the most severe form, where someone cannot think rational and they could be harmful to themselves or to others. The symptoms of these are obsessive thoughts, chest pain, extreme fear, a loss of touch of reality. This needs to be addressed immediately to keep your patient safe. Next one I'm going to go over is obsessive compulsive disorder, also known as OCD. This is a mental health disorder that is associated with usually repetitive, persistent, unwanted thoughts and behaviors. These symptoms are divided up into 2, obsessive and compulsive. Obsession is going to be your reoccurring intrusive thoughts that cause distress, uncontrollable obsessions that take up at least more than 1 hour of your day and that disrupt your life, fear of harm to self or to someone else, or a fear of contamination or germs. Compulsions are going to be repetitive action, something as like excessive hand washing or rearranging objects, rechecking or recounting things multiple times, over orderliness, a strict routine adherence, and they will feel extreme distress if somehow their rituals are interrupted. Some of your nursing interventions are going to be acknowledge their distress without reinforcing their compulsions. Gradually set some limits to help reduce the OCD behaviors as part of their treatment and provide a calm environment, a calm, safe environment. And you also want to do positive reinforcements. Try and promote some stress management, such as some breathing exercises, meditation, some exercise, some focus-based activities. Third one is going to be schizophrenia. This is a mental health disorder that entails thought disturbances, as well as disruption in emotion and perception. For the NCLEX, it is very important for you to know the difference between positive and negative symptoms. Positive symptoms are going to be added symptoms that should not be present. So that's going to be your hallucinations, your delusions, your anxiety, agitation, and your disorganized speech. Your negative symptoms are going to be those missing symptoms that should be present, just like apathy or sympathy,